Hey guys, welcome back to my channel. My name is Ruth. If you're new to my channel, go ahead and click on this video, watch it, and leave your comments and likes and subscribe to my channel. So today's video is going to be about an exciting news. So and also I'm going to give you guys update as to how my last exam went. I told you it was like my first online nursing exam, so I'm going to give you guys all of that. But let's jump into the video. So today I'm going to be telling you guys that I got a job. Yay! So I got a nurse externship job. If you don't know what that is, it's a program for nursing students who are like almost at the end of their first year. You apply for it, and if you get selected, you will be trained. You're going to work in a role of a PCT, a patient care tech, or you can say CNA. It's almost the same thing, but in the hospital setting they are called PCTs. But the difference between just a regular PCT in a hospital and a nurse assistant is that you get to work along with, during your training period, you get to work along with nurses. Because the reason I said during your training period, it's going to be like a summer job, but after the summertime you can choose to stay with the hospital as a regular PCT. But during the first your 3 months during your summer job, you're going to be working alongside with nurses, especially during downtowns when there are procedures and stuff. The nurses doing some cool stuff like, hanging an IV or something interesting, wound care, just fun stuff like that. During parents and thesis, different things depending on which floor you work, which I'll get to my floor and everything like that. You get to see a lot of cool stuff alongside those nurses during these 3 months period. But after the 3 months, if you choose to stay with the hospital, which is an option for us, you will be a regular PCT or CNA. You're going to be doing your job. You are working for the company now. You enter as your entry level was through the externship, or your decision to stay after that, you're going to be just a regular. It's like a change of title now. You're a regular PCT, which is great, honestly, because I really just wanted to have more bedside experience with patients to build my skills, because I know that the more you work in that environment, the more you get to see, the more confident you become. So it's something that I really wanted. Unfortunately, we got accepted around this time when there is the COVID-19, but I'm telling you, that has not changed anything in my desire to help out, to be there for, to care for patients. This is a field that I was interested in, and I'm still interested in, and I'm growing to love it. So I'm not going to back out of it. I'm praying for safety. We're going to be trained on different things to prepare us to work, especially during these times. So I said I was going to speak about my floor. So I'm going in as a nurse resource pool. I should check on my badge, but that's what they have. Nursing resource pool, that's what they had on it. So I'm going to be working on different floors, which is exciting. Like wherever the need is, they're going to call me, and that's where I'm going to work on. So I don't have a specific floor. I can work in the ER, I can work anywhere they need a tech. So I will get to see a lot of stuff, which is good. And the hospital that I'm going to be working for, they have two branches that I'm going to be working. with. They have two, so whichever. So I get to work at two different hospitals, and just I think it's gonna be a great experience. I'm excited about it. I'm praying that this COVID-19 goes away so we can enjoy our summer training and survive it. And um, yeah, so that's my exciting news. I've done everything that is required. I've gotten my badge and everything. I should be starting next month on the 11th. So I'm really excited about it. I like I made mention in my last video, I used to work for Walmart, but prior to my school commencement, I decided to give this new career of mine my best, and because of that, I decided to quit my job and just give it every fight I could give to succeed. But right now, at least I have completed my first semester. It's not easy, but completing my first semester gave me the motivation and helped me to know what, at least have a feel of what nursing school is like and what to focus on. I, I got to understand my teachers a little bit more. So studying is still as complex. I still have a big book to read and everything. I have assignments to do. We have class projects and stuff, which this semester was really fun, and I'm glad we were able to do most of those outdoor group projects before this COVID-19 started. So pretty much we completed the most important part of our semester before this happened. So it did not really affect our school, but the few chapters we have left now to do is like we are teaching ourselves. We have to, the school provides PowerPoint still and everything, but it's different from being in class where you can ask questions and stuff like that. But I'm going to make the best out of it. Sorry, it's my neighbors coming out of the garage. Um, so today I'm sitting on my back porch, by the way. Like I came to sit at my back porch to make this video today. Yeah, so it's a different form of learning from what we have been used to from the beginning of the semester, but it's been going good. Like I said, I was gonna tell you guys about my exam that I had last time. Well, the exam went well. Like I didn't know that I could teach myself and still make good grades. So surprisingly, your girl scored a 95 on her last exam. I was so shocked because there were a few questions that I was like, I guess I'm learning to use my critical thinking that I never had in through my first semester. There were some questions that I look at and I was like, what are they trying to do? Like, what are these people trying to do? You know, when you at the exam, like, like y'all don't want to see me taking my exam. Like my facial expression is unbelievable. So, but I was like, oh my gosh. So I had like 5 or 6 questions that I just couldn't figure out. I was like, what are they looking for? I thought about the other ways of kind of answer choices that made sense to me, but I reasoned it out, and I guess my guess were correct. So I wasn't expecting to fail, but I wasn't expecting a 95. Honestly, like I was expecting maybe 85 or something, 83, but I did way better. So yeah, we have another exam on the 21st, which I have started studying for already. I've already gone through a lot of my chapters. I have one big chapter to study though, the chapter on diabetes. I'm just, I feel like I know everything about diabetes already. They say anything you feel like you know too much of, that's why it hits you hard. So I better start studying it. Tonight I plan to start that chapter because I haven't even read it. I haven't done anything with it yet. But yeah, so far so good. that's it. Your girl is excited because this is my first job in a hospital. Like since I came to the United States, this is my first healthcare job. And I feel just having your foot in the door of the hospitals is a good thing because that's eventually where I would like to work, at least for the next few years when I get my degree. So it doesn't hurt to at least get introduced to what it feels like working in a hospital because it's different from going to a clinical site where you are not there. You are accountable for the patient for the few hours, but if anything, you can report to like your tech, call them in quickly. Oh, so thing happening to the patient or the nurse. Or, I know you still have to do that with your nurse as a tech, but then you have been really trained in that role as a tech. So I'm excited about it. I pray for safety, like I mentioned earlier. And yeah, I just thought I should let you guys in on this new exciting time of my life. I know you guys have been there with me since I started last semester, and I thought I should keep you guys posted. Alright, so I will give you guys updates as time goes on. But for now, I say bye. Let's stay home, let's stay safe. Today I had to go out to pick up some documents, but I was as safe as I could be. I used my mask when I was going out. And yeah, all right, bye.